So what is the PRAC doing to prevent and detect fraud, waste, abuse, and mismanagement of the COVID-19 relief funds? How is the PRAC promoting transparency and a coordinated comprehensive oversight? And what are some of the key challenges facing the PRAC? I'll explore these questions and so much more with my very special guest, Bob Westbrooks, Executive Director of the Pandemic Response Accountability Committee, the PRAC. So Bob, I'd like to start off with some basics. Could you provide us with an overview of the mission and history of the Pandemic Response Accountability Committee, PRAC?
Yeah, so let me start with a little bit of historical context, if I can. So, in some ways, I think it's hard to forget this background, and in other ways, it's hard to remember because we've been through so much in the past 8 months. But it was January 3rd when I think the CDC director got the first report of the mysterious respiratory illness, and I think about a month later, we had 12 cases in the U.S., and about a month after that, was, it was a full-blown crisis in America with, emergency declaration orders and stay-at-home orders and pretty big legislation. One of the big laws that was passed was the CARES Act, which many people know about. The CARES Act created the Pandemic Response Accountability Committee, and it was modeled after the Recovery Board that was created in the Recovery Act some years ago. There are some key differences, but we are a committee of 21 inspector generals. There are 22 other IGs who oversee pandemic funding, but there are 21 members on the PRAC, and then there's a full-time staff. In plain terms, our mission is to help ensure that the $2.6 trillion in taxpayer money being well spent, not being wasted or lost to fraud, and is to help ensure that the federal government's response to the pandemic is effective and efficient. Because it's our position that every tax dollar lost to fraud or waste is one less dollar available, to fund other very important programs for our neighbors in need.
So, Bob, what are your duties and responsibilities as the Executive Director of the Pandemic Response Accountability Committee?
Executive Director leads the professional staff of the PRAC and implements the vision of the larger committee. So whether it's establishing policy, selecting, recruiting, leading staff, all of that is the within the purview of the Executive Director. So, and that's what I've been doing since April 27th when I got appointed. It's setting a vision with a stand-up plan and finding the right people to implement that vision, making sure that, our stakeholders' vision, both our IGs, but also members of Congress and their staff and our other public stakeholders to make sure we're meeting the needs of our, for both transparency and oversight and accountability.
So the PRAC released its strategic plan through 2025, which is on the PRAC website. And so if our listeners want to download it, it's available there. Can you briefly outline for us the key strategic priorities for the PRAC?
Yeah, we've got four main priorities, right? It's transparency, and some of this comes from the statute, and some of it's inferred from the statute. But certainly transparency is a major thing for us, and we operate a website for that. Coordinated comprehensive oversight is another strategic priority for us, and effective and efficient operations is major for us. We need to make sure we're leading by example, right? IG should set the pace, not just try to keep up, and so that's essentially how we're organizing our activities and our staffing, our roadmaps, our 1-year roadmaps on what we're trying to accomplish and so forth.
Very important. So, as I mentioned earlier, you're kind of building the organization as the situation is unfolding. So what has it been like to set up an organization in the middle of a pandemic where everyone is working remotely?
Yeah, it's not easy. There are down in the weeds logistical issues. So you have how do I get people PIV cards? How do I get them laptops? And people don't think about it, but it's not like we control those variables because, of course, you have to go to agencies like General Services Administration for your PIV card, and you have to order laptops from a manufacturer, and there might be supply chain issues, which we experienced with government certified or spec laptops. We weren't able to get them right away. You have to have a a back-end HR function that can onboard a lot of people very quickly. So it was super challenging, and it can be overwhelming. So the first step was to develop a stand-up plan built around 30-day sprints to say, this is how we're going to eat the elephant, one bite at a time, one sprint at a time. The next 30 days, here's what I hope to accomplish. And the overarching view was, just like probably anything in life, is, if you have a compelling, urgent need, you borrow what you need from people that you trust right away until you can make other arrangements. So our initial staffing was borrowed resources from OIGs. And then we switched to reimbursable agreements for those resources. Then we arranged for, detailees to staff. And then we said, let's staff up our director level folks for the 3 lines of business next so that they can help develop their teams. And then between April 27th and September 30th, we just staffed the organization 30-day sprints at a time. And we hit our mark, several weeks ahead of time.
I was wondering, we had the bailout in 2008, which created the Recovery, Accountability, and Transparency RAT board, as we referred to it as. So I'm wondering, how similar is the PRAC to the 2009 Recovery, Accountability, and Transparency board? What best practices have you adopted? What are the most significant lessons that were learned from that effort? And what are you trying to do differently to improve the effectiveness of the PRAC?
Yeah. So when, as I mentioned, at the first when we started chatting, with the CARES Act, it happened very, very quickly, and so Congress needed to look at a model to say, how can we provide oversight? And the obvious model was the Recovery Act. So they took 2 of the sections from the Recovery Act and said, okay, let's modernize this to meet current times. So we were definitely modeled after that, but in charting our course, everybody has to recognize there are some key differences. There's differences in the statutory governance, right? We have a chair of the committee, which is an IG, which is currently acting chair, Michael Horowitz, the DOJ IG, and then you have an executive director, myself. You have more of an explicit role in supporting IGs for the PRAC staff to both conduct and support oversight and support IGs in their work. And then there's mandates to leverage existing technology. So that's sort of one key difference. Second major, right, is that we're already 3 times larger in terms of dollars than the Recovery Act. And it's not just the amount of money, it's the nature of the spend. If you remember the Recovery Act, right, it was shovel-ready projects that you could get out in front of and build a transparency. And then you were relying upon citizen IGs to look at a website and call a hotline to say, hey, it's reported on your website that there's going to be a new police station built or a new municipal parking garage. I don't see that being built in my neighborhood, out in whatever state. And so a lot of the, it was driven by this whole citizen IG model of people being able to identify fraud in real time and report it. With us, a lot of the money's already been spent, right? So, and it's not tangible things. These are things like, unemployment insurance and whatever. So it's super challenging. 2 other things that I think are important to note is with the Recovery Board, you had the designation of a senior government official, the vice president, who happened to be Vice President Biden, was the recovery czar, right? He was a force multiplier for the Recovery Board to make sure that there was transparency affected throughout government. We haven't had that in our first couple of months. And then the final thing is the IGs back in 2009, they didn't have native data analytics capabilities to any large degree. Now a lot of them do. So the model is, while there's similarities in how we're structured and whatever, we have to meet a different need, both in terms of the transparency of the data, but more importantly is how we facilitate oversight across government. And so, building a data analytics function is much different today than it was back then. Certainly a lot of best practices that we are leveraging and relying upon, one of which is just the power of bringing the IGs together, and so much more can be done. The power of having a top-level data analytics capability. Those are the things that we're replicating, but we're also recognizing, the differences.
So, Bob, could you tell us more about the efforts to promote transparency on the usage of the $2.6 trillion in coronavirus relief funds? Yet more importantly, what is being done to provide the public with timely data and information on the usage of these funds and the coronavirus response in general?
When the CARES Act was signed into law on March 27th, it contained a provision in there that said the PRAC was required to establish a public website within 30 days. So that was a great gift and a timeline that Congress gave us. And we met that as a community. So on April 27th, the same date I was appointed and required to be appointed, we launched a website. That website is at pandemicoversight.gov. And it is, there's a number of things in statute that we're required to provide, and we're trying to provide more than that. We acquire data from various federal data spending sources, and we map it, we make it searchable, we make it downloadable, and we combine it with other data, including accountability information, OIG audit reports, for example, and investigative press releases. So and we structured the website really to meet the needs of a range of users. So it's really, we hope that it meets the needs of the casual member of the public that is just curious, that is just going to the website for general information, as well as power users and folks, either in policy or academia that can go and download large data sets and do their own analysis of the spend. We have on there now USA spending data. We have links to other data sources, and we hope to have launched by within the next 10 days by November 30th. We'll have up the coronavirus relief fund data from Treasury. So, and our plan is moving forward is to identify additional complementary federal data sources, ingest them into our system, map them, display them, make them searchable, make sense of the data, and combine it with federal accountability information so that policymakers can make sense of how we spent our money and was it spent wisely.
Bob, how do you see the use and application of artificial intelligence, machine learning, and cloud computing in meeting the mission of the PRAC?
So on the cloud computing, it's easy. It's our website, and our pandemic oversight platform is it's an Azure cloud-based system. We are looking at things in the following way, and that we're going to be successful when we look back in 5 years and we can point to specific examples where we've applied AI and machine learning to practical problems and didn't just add them on as novelties or gimmicks. And I think that sometimes when you're dealing with new technology, it's unavoidable that things can be slightly gimmicky. For us, we don't have that luxury of that. So it's going to have to be very practical problems. I mentioned, problem with in the recovery board days was finding fraud in the data and using technology and data analytics to find fraud in the data. We have plenty of fraud that's been identified. We need to now use technology and AI to shorten the investigative process and substitute out whatever we can, substitute technology for shoe leather. You're always going to have shoe leather on cases. Unavoidable, right? You're dealing with people, witnesses, and whatever. But to the extent that we can make life easier for investigators and shorten the life cycle of their cases, that's the sweet spot of what we're looking for. And I think technology is really the answer in that space, right? We got to be able to substitute in AI and machine learning here. And I think it's going to be a great opportunity for us.
So I'd like to turn to the future, Bob. What do you see as your highest priority over the next couple of years? And more importantly, what would you want to achieve over that period?
It's really to bring together the community, have is a whole of government approach, using all the tools, I think, at our disposal. I think it's always been a criticism, and perhaps a fair criticism or observation of the law enforcement community, that there's oversight community that there's audits and investigations. Well, there's a lot of tools in the toolbox with civil authorities, administrative authorities, and so forth, analytics. So, but what drives us fundamentally is when we're done in 5 years, we want there to be an enduring impact, right, on transparency and accountability, not just in raising the bar generally, but sadly, I think we all know this isn't going to be the last disaster or event that we're going to have to deal with, and we can't be unprepared again, right? So if we can work with OMB to make significant progress so that we can be better prepared, I think we'll all be better for it. And to me, it's, you use these terms, it's agile oversight and applied technology. If we can make advances there, I think we'll be hugely successful.
This has been the Business of Government Hour, a conversation with Bob Westbrooks, Executive Director of the Pandemic Response Accountability Committee, PRAC. Subscribe, download, and listen to the entire interview at Podcast One, iTunes, or on your favorite podcast app. And as always at businessofgovernment.org.